A very warm welcome, everyone. I, Dr. 𝗘𝗙𝗏𝗏, once again on behalf of Voice of Healthcare, welcome all my viewers who have joined in for our virtual series. Voice of Healthcare, in collaboration with Espera Nutrition, has taken an initiative to bring together an interview series talking about the importance of nutrition during oncology care. Today, we have with us Dr. Ankur Varshney, consultant medical oncologist at Medanta. Good morning, Dr. Ankur. A few words of self-introduction, please.
Good morning, Dr. Nishant, and hi everyone. I am Dr. Ankur Varshney. I am a consultant medical oncologist. In a simple language, I practice and I manage the patients who are diagnosed with cancer at Medanta Hospital, Gurgaon.
Right, sir. So today, as I have already discussed with you, Dr. Ankur, we will be discussing about your views and your opinions on the importance of nutrition, the importance that nutritional, the pivotal importance that it holds in any oncology case, let alone be it pre-treatment, during the treatment, or after any chemotherapy or oncology treatment. So I'll start shooting the questions and let's try to create an impact and engage with our viewers. So the first question here is, could you share your perspective on why nutrition holds such an crucial role in any cancer patient's journey? And how do you feel that the nutritional status of a patient helps them cope with the treatment and the overall well-being of a patient? Over to you.
Okay, first I will like to make a small correction. Not only cancer, nutrition plays an important journey in every person, rather being he is suffering from a disease or not. And the main issue is that are our wide prevalences, which we don't focus on the quality of the nutrition. And the issues which we face, which are pre-existing in our patients, is that very first, the iron deficiency anemia is quite prevalent in India. Almost 50% of patients are having low hemoglobin, preferably who are females, young children, and they don't have sufficient iron levels in our body. Secondly, in our patients who think that they are from affluent society, then these patients have a common disease, that is diabetes, which is a form of malnutrition again.
I think we just lost your internet connection there, Dr. Ankur.
Sugar levels, high low proteins level, which we face in almost every person. Now coming to the cancer patients. Cancer patients, they do have these pre-existing illness, and what other problems they face, that the most common cancers are in India is head and neck cancer. Now with a patient who is having an ulcer in his mouth or some swelling which interferes with food intake, then definitely this patient is having a malnutrition, which is the basis of due to disease, and it is at the presentation level. Now there are certain again other cancers, like such as cancers of gastrointestinal tract, like cancers of esophagus, stomach, where the tumor is there in the body and it interferes with the absorption of nutrition, leading the patient, compromising the nutritional status of this patient. This is the pre-existing and caused by disease. Now the treatment, malnutrition is again caused by the treatment which we are offering to cancer patients, such as radiation and surgery. When in surgery, we remove a part of the body, such as we remove a half part of the tongue or some intestine, some is part of the stomach or esophagus, then these linings are destroyed. And this again had a problem when the nutrients are not absorbed, because the normal intestinal lining is missing. Now, if we go with the radiation or chemotherapy, a common side effect of both these is mucositis. That is, there are ulcers over the mouth, ulcers in the esophagus, and ulcers in the intestine, which are many a times painful, may have bleeding, and thus the patients are unable to take food. These patients are more prone for having fungal infections in the body. And again, this is the thing that led to disruption of absorption of quality nutrients from the food which we eat, and delaying any nutrition food absorption, and many a times patient doesn't take because of the pain caused by these ulcers. So these are the forms why malnutrition is prevalent in cancer patients. Now the era of oncology is changing its goals. Earlier, every patient and every person was focused on achieving the cure of the disease. We only used to go know and get to know. Patient always perform question: how much time I will get my cure? My cancer will be cured. This was the only question. But
Right.
with the now we are having many quality of the drugs like immunotherapy, targeted therapy, and these patients are living long. So the
Right.
era of this now cancer care is of comprehensive cancer care, in which we focus on the quality of the life of the patient rather than achieving the cancer cure targets. We don't focus that CT scan report will show a complete eradication of cancer. We just want that patient should live a normal life as he was living before the cancer diagnosis. He should do his routine activities. He should participate in social activities.
Right.
So when
Right.
this comes, nutrition comes an important aspect, and this helps us. The many first thing, if a patient presents with persistent anemia, then we request
Hmm.
frequent blood transfusion. Chemotherapy sessions are delayed, and
Hmm.
when these are happening, so outcomes of cancer are already compromised. But if we
Right.
focus on nutrition, then patient has a better tolerance to chemotherapy, radiotherapy, or surgery, and
Hmm.
they do well as compared to the patients who are having a malnourishment.
Right. So very likely you said that every cancer case is unique and there needs to be certain personalized nutritional plan or a personalized nutritional activity that we should plan. So I would like to hear your views about your tailoring nutritional recommendation for individual patients and along with any example that you can give where the nutritional support that you provided for a particular cancer actually made a significant impact in the overall treatment experience of a customer out there.
Okay, I will like to
Yeah.
share two things.
Hmm.
That whenever a patient comes, we
Hmm.
only first assess it through the nutrition point of view. Also, what are the serum albumin levels? What are the
Mhm.
actual hemoglobin levels? And if we found any defect, we go for extensive testing why these levels are low.
Hmm.
Secondly, when we face a patient with a head and neck cancer or a cancer who is having GI problems, then we
Hmm.
go for upfront nutritional assessment in these patients, because these patients already had a baseline nutritional problems. And
Right.
with treatment also, when they will have the radiation and when they will have the chemotherapy, they are expected to have some side effects which will compromise their nutritional status. So
Hmm.
in these patients, we ask for their nutrition. We are our dietitians to go for a regular diet counseling and assess them and advise intake of food accordingly. Now, when you
Right.
ask sharing of some cases, so I will like to share two cases which I have managed on the basis of nutrition. We had a patient of hepatobiliary cancer, and this patient used to present us with recurrent fever with after every chemotherapy cycle, and tolerance was to chemotherapy was very poor,
Mhm.
and had frequent admissions for blood transfusion. Then we investigated, and we found that the patient has a low albumin levels and low levels of vitamin, which causes him anemia and low
Hmm.
tolerance to chemotherapy. So we start replenishing him with the food supplements, and every time when he came for chemotherapy, we used to give him multivitamins administration, which later on supplements his vitamin level. And then after this, he tolerated chemotherapy very well. And as soon as we start replenishing the nutrition in him, then
Hmm.
this patient had lesser side effects of chemotherapy, had less frequent hospital visit, and later on tolerated chemotherapy in the full doses and had a good response to chemotherapy and is currently doing well. One more case, when she came to me, she was again a cancer patient of intestinal tract, and I found her very weak, nutritionally deprived. So the patient was initially not fit for any treatment. So I just refer her to a dietitian, gave her
Mhm.
painkillers, started on her proper diet schedules, and after 15 days, when she was also once admitted for the nutrition supplements, so that we can replenish her nutritional status. And after 15 days, we show the patient who initially came on a wheelchair has started moving on, and
Hmm.
now the patient which was initially unfit for chemotherapy was given low doses of chemotherapy. The patient responded to it. The patient's performance status, who were initially 3, came to 1. And then we started on her proper doses of chemotherapy. And currently the patient is responding well to it.
Right. So I think these very crucially solidifies the important role that nutrition will play in the treatment plan. So during the course of any oncology treatment, let's talk about how can we empower the patients and their caregivers with the knowledge of why nutrition is important. So in your practice, in your experience and observation, the key pieces of advice that you consistently give to the caregivers and, let's say, the patients who are ongoing the treatment about the role of the homeostasis of nutrition that they need to maintain along their cancer journey. A few views on that, please.
The very first thing that I tell my patient is to stay away from the myths. There are many myths prevalent in our society, just like that don't take the sugars, they increase the cancer incidence, they increase the cancer, upgrading the cancer to stage 4. The second thing is that many are things, some people also say that don't take the milk. It is a rapid cancer spread. So I just, for the very first thing that I emphasize my patient is, do not go with any myths. If there is any such a thing that this will increase the cancer, this will interfere with your treatment, then a doctor who is treating, they will tell you. Or when we will send you to a proper dietitian or nutrition expert, they will tell you. So
Right.
don't go what is available blindly on social media, what's the message forwarded on WhatsApp. Don't go with them. Take proper nutrition which are advised by us. We
Right.
prefer home-based cooked food, which was patient routinely used to take, rather than modifying any extra supplements, and just used to modify it according to the patient's dietary habits, which was only pre-based, because then only the patient will accept the food. If we
Correct.
started incorporating foreign food particles or some other particle, they are not acceptable to taste to many Indians. So we started to modify the diet chart according to the patient needs. What we focus is we focus on intake of sufficient quantity of proteins and micronutrients. Micronutrients which include multivitamins and minerals. These are our important focus areas.
Right, sir.
And
I think very, very crucial, crucial statements for the importance of nutrition here. You were saying something. I'd let you continue, please.
I just saying that we usually send these patients for a proper nutrition counseling and
Hmm.
prepare the diet charts according to the home-based care food. In case patients are unable to take home-based care food in proper needs, then only we start adding supplements to them.
Right. So that solves one part of the question. Now, talking about, let's say a patient has completed their oncology care. Let's talk about the post treatment nutritional dependency and the post treatment nutritional importance. That, in your views, what it holds and does it play? Because you obviously know that proper nutrition will play a part of. A very important part in helping them regain their vitality and their
Yes.
normalcy before the journey. So I'd like to hear a couple of your views on that as well.
After post treatment, this mainly signifies to the patient who have undergone intestinal and pancreas surgery,
Okay.
because these are the important important organs which play a part in the digestive tract. So in these patients, we usually give them supplements adequate enough, and depending on the what the levels of nutrition came in our assessment daily,
Hmm.
day-to-day basis. So in pancreatic surgery patient who have undergone removal of pancreas, we used to give them pancreatic enzymes as a supplement. In
Okay.
patients who have undergone intestine surgery, we focus them on to provide a change in their dietary plans.
Hmm.
We advise them to undergo rapid, frequent, small meals which can be easily digested by them and can be taken by them easily.
Right. All right, sir. I think that puts our questions to a close. Any last key takeaways or key message that you would like to give to our viewers on this while we are celebrating National Nutrition Week and particularly talking about care in oncology? So, any particular message, one last key takeaway that you would like to give to all our viewers here?
Well, the only message that I would like to give is stick to the doctor's advice. And when we take advice, then we should do it from a registered practitioner or registered nutrition person is having a significant experience in these things, rather than going with the उसने ये कहा उसने वो कहा मुझे यहाँ से ये
Hmm.
advice मिली. And don't depend upon the myths. Realize what the science is this behind this and what is the logic behind this, then only we should go for that thing.
Right, sir. I thank you for your educating words and your participation in the impact that Voice of Healthcare is creating on this Nutrition Week. And with this, I'd like to bring the session to completion. And once again, I thank you, Dr. Ankur, for stepping up and helping us engage with the viewers and talking about the role of nutrition and oncology care. So thank you and have a good day.
Thank you. Have a good day to you.